We will try to explain you about stroke in detail and in a simple way. Causes of stroke. A stroke is caused by a disruption of blood flow to the brain, either by a blockage of a blood vessel, ischemic stroke, or by bleeding into the brain, hemorrhagic stroke. The most common cause of ischemic stroke is a blood clot that forms within a blood vessel in the brain or travels from another part of the body and becomes lodged in a brain artery. Hemorrhagic strokes are typically caused by high blood pressure, which weakens the walls of the blood vessels in the brain and can cause them to rupture and bleed into the brain tissue. Other risk factors for stroke include smoking, high cholesterol, diabetes, heart disease, and a family history of stroke. Stroke symptoms. Stroke symptoms can vary depending on the location and severity of the stroke, but some common symptoms include 1. Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. 2. Sudden confusion, trouble speaking, or difficulty understanding speech. 3. Sudden trouble seeing in one or both eyes. 4. Sudden trouble walking, dizziness, loss of balance or coordination. 5. Sudden severe headache with no known cause. It's important to note that not all strokes have all these symptoms, and some strokes may have additional symptoms. Additionally, some symptoms may go away quickly, leading the person to believe they are not significant. If you or someone you know experiences any of these symptoms, seek medical attention immediately. Time is critical in treating stroke, and prompt medical attention can make a significant difference in the outcome. Stroke treatment steps. Stroke treatment typically involves the following steps. 1. Emergency care. If someone is having a stroke, they need emergency medical attention as soon as possible. Call emergency services immediately. The faster they receive treatment, the better their chances of recovery. 2. Diagnosis. Doctors will conduct tests to determine if the stroke is ischemic, caused by a blood clot, or hemorrhagic, caused by bleeding in the brain. 3. Ischemic stroke treatment. If the stroke is ischemic, doctors may give a clot-busting medication called tissue plasminogen activator, TPA, to dissolve the clot and restore blood flow to the brain. This medication must be given within 3 to 4.5 hours of the onset of stroke symptoms. 4. Endovascular treatment. For some patients with ischemic stroke, endovascular treatment may be recommended. This involves using a catheter to remove the clot or deliver medication directly to the affected area of the brain. 5. Hemorrhagic stroke treatment. If the stroke is hemorrhagic, doctors may need to control bleeding in the brain, and surgery may be necessary. 6. Rehabilitation. After treatment, stroke patients will typically need rehabilitation to help them recover function and regain their independence. This may include physical therapy, occupational therapy, speech therapy, and other forms of rehabilitation. Additionally, lifestyle changes such as quitting smoking, eating a healthy diet, and getting regular exercise can help reduce the risk of future strokes.